Welcome everyone to the 2024 World Evidence-Based Healthcare Day Connected Conversations interview series, where we speak with a wide range of people from the global evidence community around both their personal and professional journeys in using evidence-informed approaches to take action for health and beyond.
In today's interconnected world, we face, as we all know, complex challenges like climate change, biodiversity loss, and public health crises. These are becoming increasingly serious, immediate seriousness, existential crises, and they are increasing in the public awareness and indeed in their public action, to demand action from more institutional sources, be it government or business. Tackling these in isolation just doesn't work. That's where evidence-based approaches become essential, and they allow us to bring together insights from different fields, giving us clearer, more comprehensive views of these complex issues. I once illustrated this looking at government's overarching sustainable development goals as clearing the plates of spaghetti. We cannot deal with these by picking individual issues. We have to look across the whole system. So throughout my career, be it in government or be it managing areas the size of Wales in Southeast Asia, I've witnessed the power of bringing together and evaluating evidence from different fields. This really does help us get a more complete picture of these complex issues and come up with better solutions. One thing I did say to one person quite a long while ago was, you may be the only decision maker in the room, but if you listen to multiple perspectives and you assess multiple sources of evidence, you as an individual will make a better decision. If you collaborate with multiple partners and work through the difficulties of collaborative decision making, you will make even better solutions that are even more sustainable.
Well, I think with the complexity piece, you see more and more need for multidisciplinary approaches to whether it's research, whether it's those making sense of synthesis, and then getting a different mix of people around the table with the relevant multidisciplinary expertise. So I would say that with the fluidity of more fluidity of communication, and again, technology tools and other ways of doing so, that could be easier. I also think it's on funders, governments, and others and commissioners of research and synthesis to be promoting those kinds of conversations and formats.
Yeah. I think evidence-based approaches is key. For example, why are we talking about evidence? Because before now, there was no evidence. Or even if evidence was being used, the quality of the evidence or the status of that evidence was questionable. But now, if we understand the meaning of the way evidence-based or evidence-informed decision-making has been conceptualized contemporarily, I think people have to be on the same page. And there's a lot of positive outcome using the most current evidence to inform decision-making in addressing different types of problems across sectors.
Our society is rapidly and constantly changing, and so are its problems. This increases the need for faster, more specific and complex solutions. As a result, public policy challenges have become increasingly complex. Can you imagine working with an evidence-based approach that considers government, academia, civil society, industry, and environmental factors to improve healthcare and policymaking? Well, in Brazil, this is becoming our reality.
We were very lucky when we started Cochrane Rehabilitation. Also, the WHO, the World Health Organization, launched a call for action called Rehabilitation 2030, which is all about strengthening rehabilitation in health systems. And we have been working with them and advocating, ending up in a resolution adopted by the World Health Assembly last year in 2023 to strengthen rehabilitation in health systems. And this resolution explicitly calls to member states and all stakeholders to work on evidence-based interventions and also specifically on health policy and systems research.
Research efforts are always a team effort, and provision of health is also a team effort. But we should also keep in mind that a team is built with individuals, and it's important for every individual to identify their role and to make sure that they perform their role to perfection. So, right, every individual contribution makes it a good team contribution as well. So that holds good in every domain, more so in the domain of health. So though most of them believe that health promotion and practice is a teamwork, we as individuals can play a part and we can make a difference in the team. So when I say an individual contribution, it can be even as small. It does not mean a monetary support or a monetary contribution. Even a small way of help, like disseminating evidences through social media, or just presenting evidences in conferences, or guidelines or practices in continuing medical education sessions.
When we think about phrases like evidence-based or evidence-informed, you always have to think, well, evidence according to who? You know, and who was involved in creating that evidence or deciding that the data was evidence? And in lots of places of human knowledge, there's areas of ignorance as well. And I think, you know, thinking about how we map what we don't know and why don't we know it. These are really important questions, and you can't answer those questions without asking as many people as possible for their different perspectives. You know, not just professional researchers, but also members of the community, members of the public, citizens, whatever you'd like to call people. And I think when you start to ask that question, you know, what's the best way of, I don't know, involving patients or involving the public in generating evidence? The answer, of course, is you need evidence-informed methods of doing that. And I think that at the moment is where we as a species are struggling in terms of having evidence-informed ways of involving people, multiple stakeholders. You know, how do we bring together industry, professional researchers and the public in ways that are transparent? And at the moment, we don't have a lot of data about the best ways of doing that because it's not being reported in transparent ways. So that's certainly one of the things that's been looked at by the project that I'm involved in. It's called Standardized Data on Initiative, or STARDIP, STARDIP. And we're working with multiple organizations, including Wikimedia, who are hosting it. And the idea is that you can report things like evidence synthesis in standardized ways, including, you know, who was involved in doing which task, you know, how was the data gathered, who was analyzing it, who has which interests, are they financial interests or personal interests? You're just trying to map those different perspectives so that you can begin to answer the question, who generated this evidence and is it high quality? And can we do a better job of involving people from multiple different perspectives or communities in that? And I think that's particularly important when we're working with Indigenous peoples around the world as well, where we really need to make sure we're getting that right and those people aren't being unintentionally excluded.
Well, I think a big challenge in the global health space is the business model being still very driven by certain actors that have probably a lot of power in particular spaces. And so one of the things that the Global Fund is great at is getting civil society, governments, private sector, other actors together around the solutions. And so I think that's a lot of it, is getting those different actors looking at the same evidence and valuing the evidence and using it to make decisions. But you can't do that unless you're opening up the model from the start.
The United Nations Sustainable Development Goals are woefully behind where they should be if we're going to hit the 2030 target. The evidence synthesis community is really well positioned to contribute to the achievement of the goals, but we do have work to do. We need to better coordinate effort and reduce duplication so that we can facilitate more timely and affordable evidence. The Building a Global Evidence Synthesis Community initiative is aimed at overcoming these challenges. We need a cross-region, cross-sector approach that builds on existing strengths, and there are many, but we do require a bit of a leap of faith. It will require us to be a bit courageous if we are to achieve the changes that are necessary. We've only just started this important dialogue with different groups from across the world, and the response has generally been pretty positive. There really is significant opportunity for us to learn from each other to create something exciting and new that will generate real impact. Just being better connected is a big win, but I'm hopeful that we can do much, much more together going forward.